Hello and welcome back to another edition of GNAT-TV's In-Depth series. I'm Andrew McKeever, the news director here at GNAT-TV's News Project. It's a pleasure to have you with us today. It's also a great pleasure to be joined by three officers from the United Counseling Service in Bennington, who also has a branch up here in Manchester, here to tell us a little bit about what's been going on with their organization and some of the issues they've been dealing with since the arrival of the COVID-19 pandemic. Really pleased to have with us today Lorna Matern, who is the Executive Director of UCS, also Alia Reeve, who is their Medical Director, and Kea Ganguly, who is the Assistant Director for Youth and Family Services. Ladies, thank you very much for making the time today to be with us. And Lorna, let me start with you. I guess, what's been the impact overall on United Counseling Service of the coronavirus, COVID-19 pandemic? Have you been seeing a big uptick in demand for your services or differences in the way you're going about doing things? What's been the story?
Well, it's quite a big story, actually. We, as soon as COVID hit, actually Bennington, that was the first case in Vermont, was right next door at the hospital. We had been working and starting to work on how we were going to pivot our services to respond to the needs of the community, the needs of our staff and our clients currently. And as soon as the situation hit next door, we put that plan into place. And so we very, very quickly moved to providing virtual services to our clients. We moved to having most of our administrative supports move off-site and work remotely, which we've never done. So probably about 90% of our workforce is working remotely. Our clinical teams are doing telehealth, which we had never done before, or very limited. We did it with psychiatry, but it's very, very limited. And so now we are providing that to most of our clients is through telehealth. We've also moved to provide phone therapy when people don't have access to a computer. We very, very quickly moved into mobilizing our emergency services team, who spent a significant time in the emergency department at the very beginning of the process because of people who were feeling anxious and overwhelmed by everything, providing support to the medical professionals at SVMC who were very much on the edge of this pandemic and getting ready for what we all thought was going to be a surge in Vermont. And so we also very quickly did a lot of pre-surge planning to the point of creating a psychiatric reception, I suppose, to be able to divert folks from the emergency department so they didn't get exposed to COVID in the emergency department if they were having a mental health issue. It's amazing what it is that we actually were able to do in a very short period of time. We have a core team that meets on a daily basis to look at how we move and change and expand or restrict our services depending on what the governor has to tell us, or depending on if there are any hot spots, if we have to make any changes. So we've really grown into this very nimble, very innovative, providing very exciting ways of being able to connect to our community and to our clients. One of the things, really briefly before handing it over to some of my colleagues, is we've also had to, of course, cancel some very important fundraisers, like our Bowl-a-thon for our mentoring program and our barn sale that happens in September up in Manchester. We've also had to cancel as a result of this. And so that's an issue that we have to deal with internally for funding. And we've also had to cancel some very important community education pieces. We have a series called UCS Presents, where we often present a documentary and then have a discussion afterwards, and we've had to cancel all of those community education pieces. But now we have to pivot and turn again to find out how we can bring those education pieces back into the community, but in a virtual way. So we're in the middle of figuring how to do that, just like you are, Andrew, and doing this in a virtual way. So I'll turn it over to Alia or to Kay if they want to add anything.
Hey, why don't you talk about Puck and I'll pick
Sure.
up
And I can talk about some of the other things we're doing. So initially when we started dealing with COVID, of course, everything went virtual. So family emergency services went virtual, and we actually had to close down the psychiatric urgent care for kids that we've been running very successfully under a grant. What we found as time passed is we started seeing a lot of stressors on families, of course, especially for our older kids. Our tweens, our teens, developmentally, it's not normal for a kid to be with their parents 24/7 when they're a teenager. So their behaviors were escalating. Some of them were taking off from home. So there were a lot of issues we were seeing in that age group. And after consulting with Alia and the team, about 2 weeks ago, we reopened Puck on a very limited basis with very stringent safety guidelines in place. And we've been very busy since we've done that, because what we've been able to do is use this service as preventative, like an urgent care should be. If you're starting to see a kid start to spiral or a family really struggling, we can arrange with them to bring the child in or the youth in and spend some time working with them, giving them coping strategies, doing assessments, and hopefully preventing them from hitting the point where really intense intervention needs to be made. We've done that. My team has been amazing. I can tell you I've always had nothing but the utmost respect for what they can do, but what they've done during this crisis has been truly astonishing. They've done everything from, we've created this huge sensory toolbox where we can draw from different tools, everything from body socks to some type of motion, coloring, and they will actually package sensory tools up to the specific family who might need them and do a drive-by and drop them off on the porch. So they're actually really being innovative. One of our clinicians just created Flat Becky, who kids can print out and take on adventures in their yard and send to their clinicians back. We have clinicians playing Connect 4 with kids while talking to them to keep them stabilized. So we have probably been busier than ever, but in a very innovative manner. And my staff have thrown themselves wholeheartedly into doing whatever they can to keep youth and families stable and safe and receiving services.
All right, very good. Well, Alia, what's been going on over in your area?
Well, as a medical director, the psychiatric medical team supports all aspects of clinical services, and I specifically also oversee closely the emergency services supports and outreach. So there have been a couple of things that we've done consistent with what both Lorna and Kay have described as our clinical interviews with patients for follow-ups have continued pretty much at the same pace as before, and our new evaluations are continuing at about the same rate. So people are coming in for new appointments and getting started or medications reviewed and diagnoses reviewed. Half of our team is only working remotely. Half of our team is on site, but only working virtually. The difference being is that even patients who are coming in the doors at Manchester or Bennington, we have a video room set up for telehealth internally. So a clinician or one of ourselves as providers will be in one office and the client will be in the other using their video screens, just like you're communicating with us using video and auditory connections on Zoom, we use either Skype for Business or the Zoom Health connection. So it maintains confidentiality of private health information, or PHI. We record these in concurrent documentation in our medical records. So in that sense, it's very much the same clinical follow-up that a patient normally has. A few people do not have telehealth capabilities at home and are not willing to come into the office or are very loath to use public transportation, and we will do a telephone interview. It's not an acceptable risk to do that for a new patient that we have never seen. We need some kind of visual connection to validate their history, their emotional expressions in their body and their face. And so the camera allows us to see how they move. And I can tell you personally, it works. My mother, who is 93, had a follow-up with her primary care, and we did that at the dining room table using our computer connected to SVMC, and I was able to angle it in such a way and move it back so that he could watch her after a 15-minute interview, also get up and use her walker and walk around the table so he could actually see her movements in 3 dimensions. And so being on the receiving end, I know that it does work. Being on the receiving end as the practitioner, I know that when I'm seeing patients move and do specific actions, I'm verifying a tremor, or I'm looking at stiffness, or we have the scale in the telehealth room they can get on and tell us the weight. So we're getting our biometric pieces of information that we need for monitoring people. So that's the medical piece. The outreach in terms of SVMC, where we have a consultation contract for both psychiatric and emergency care, has continued apace, where we're providing supports to the staff as well as who are frontline workers, nursing staff, mental health workers, front desk staff, as well as the hospitalists and physicians. And so it's a very, as described for New York City and other places in the news, it's a very draining time with so much uncertainty. And so what has happened in the medical community, is amplified a little bit about everybody's dependence on them making good decisions without knowing exactly how it's going to turn out. And so that's where part of the stress on the health provider is, first was looking for the surge coming, anticipating what the needs were, learning a whole new set of protocols, learning how to do their routine emergency care or hospital care through a mask, through a face shield, with difficulty visualizing your airway when you're intubating somebody, deciding whether oxygen works better alone, with or without a ventilator, integrating information that's inconsistent from different settings, all of that. And so that, we're talking about what's the impact on the community, well, our health providers are part of our community. Then their information, their anticipation, the data that's going on around the state informs our preparedness as well. And when we look at the national and international data, we see and anticipate the psychiatric sequelae of enforced isolation of being home is going to be coming out, but it's about somewhere between a 6-week to 3-month time lag from the peak of the medical crisis. So it's a slower time lag. And the curve will come up. It will show up in different ways. We are certainly seeing it in our children and families where there's a lot more testing of boundaries. There's a lot of reactivity. There's a lot of parents who know that their children aren't bad kids, but are just at their wits' ends of trying to deal with the platforms for education, having to have 7 different passwords for 7 different platforms for 7 different teachers, for a kid in elementary and a kid in middle school, having different sets of expectations and performances. The unrelentingness of it is what's the impact. For our patients with chronic mental illness, initially they just hunkered down and kind of hoped everything would be fine. And we're glad to know their medications would be delivered by the pharmacy. Yay, they were safe. Now they're wondering, how safe are they? Who do you go out and talk to? How do you get your groceries? Who can you talk to? How much more can you do? Those uncertainties become much more difficult to figure out what's the best way to move forward. And it's something that has to be figured out in small groups, in bringing in additional resources and practices. It's helpful to do non-traditional medical techniques, in other words, complementary and alternative medicine techniques that modulate your biological responses and your cognitive responses. Like the difference between developing a plan to deal with every challenge. An example is the chief medical officer for SVMC pointed out there is no emergency during a pandemic. And yes, there are emergency situations, but the fact is the entire situation is an emergency. So there's no more emergency on top of the emergency. So there isn't new violence in a war. You know, it's that kind of a thing that you're at that extreme. So then it's, how do you find ways to mitigate the impact of the onslaught of all that information? And then we go back to mindfulness. We go back to taking breathers. We go back to being outdoors and making use of nature. We go back to finding meaningful connection with people. So virtual connections are essential, but also meaningful conversations and time for oneself, and not just being inundated by disaster and numbers, but also what has worked and what has worked for your neighbors. And how do you think about July and August and September? And how do you anticipate the fact that there will be recurrence of these symptoms in different people in the community? And we don't know the exact pattern that will hold. And so how do we make room, as Lorna was saying, for expanding our services and having to contract them? And so we're developing these tiered layers of how much we offer in what kind of way, and how will we communicate that we are switching from one kind of open door to a different kind of open door. So I'll let you guys chime in here.
Yeah, well, I was wondering what you all thought might be the sort of the longer term factors that might be in play. You sort of addressed them a little bit there, Alea, but and it looks like the governor is sort of gradually opening some of the restrictions. People are able to get out a little bit now that they weren't technically supposed to do or able to do before now. And I've been wondering, kind of, looking forward toward, through the summer and then maybe into the fall, if there are going to be some longer term concerns that you all may have about.
I think there definitely will be. We're very lucky. One of our limitations is also one of the strengths is we don't have a high population, but we also had a very responsive population as a whole compared to some other niches around the country. People did stay home, and the social isolation cannot be underscored for the importance it's had in preventing more people from getting sick, so that our ratio of people getting sick and dying is lower than in some other states because of how we've handled it. Also, the governor has been among those at the forefront of being transparent, of putting in place a stay home, stay safe order, and releasing it in gradations, not in a big fell swoop. And so that people are more conscious of how they are releasing their restrictions, to be more aware of how they'd have to pull back. A big one is going to be the amount of interactions that kids have at school, I think.
Right.
And
And
there are a
Kay,
lot of things being talked about.
excuse me. Okay, I was just wondering if you wanted to speak to that a little bit about how that may play out with the children and your youth services. I would imagine that, boy, it must be awfully hard for not only the kids, but their parents and families to be kind of, quote unquote, cooped up in the house for much longer periods of time than they're used to.
Yeah, I think it's very stressful, and no matter what we think we know or what we do or don't know, this is a traumatic event for kids, and we know the long-term effects of trauma on brain development, on social engagement, on social emotional skills, and we're asking parents to wear a lot of hats. I know Alia touched on it, but I've talked to parents who are expected to be parent, teacher, speech language pathologist, special educator, physical therapist, plus working their own jobs. So their plates are full, so the stressors on them can't be overstated. And no matter how good of a parent you are, you're still a human being. And when this happens, the kids perceive the stress around them and they pick up on it. So long term, I'm very concerned. I think we're going to have some issues as things open up. I think we're going to have challenges. We always know for any child that 3 months that they're off in the summer, when they get back to school, it takes them a couple of weeks to get back in the swing of things. Now we're looking at a 6-month period where kids have not been in school and not had that structure, and they're going to go back to school. And I've talked to teachers, and I know they're looking at different ways with social distancing. Not only will they be going back to school, they may be going back to school in a pattern that they're not familiar with. So there's a lot of added stress. I know it's conversations that we're having as a staff on how best to support parents, how best to support kids. And we're really trying to listen to our families. What do you need is one of the things we're asking over and over and over again. And really trying to listen and be responsive and figure out ways to help get those needs met. I know one of the things that I've been repeating over and over again, especially again, touching on the teens, is parents talking to me going, I don't know what to do. My kids won't do their schoolwork. Mm. And I keep telling them, I said, here's the bottom line. You have so many stresses. You do the best you can, and then you let natural consequences happen. If they fail because they're choosing at the age of 15 or 16 not to do their schoolwork, that's your consequence. You don't want to live in an armed camp when you can't get out of your house.
Andrew, I just wanted to also speak to, as an agency, and jumping off what Kay was also talking about for trauma, we know that we are living through a crisis that creates trauma. Not only, just thinking about the surge and preparing for the surge and the level of anxiety that brought to professionals and to community members, that will bring about a feeling of trauma. We know that as we continue on with some social distancing, we continue on wondering whether or not there's going to be another hotspot or another surge of COVID-19 in the fall or in the winter. People are on the edge. And so we know as an agency, we are also preparing for folks when they start getting outside, when they start getting back into life, whatever that means, that we know that there's going to be an increase in anxiety, an increase of trauma, an increase of depression. We know now that there's an increase in substance use and domestic violence and violence towards children. So we know those things are happening now. We are open. We've continued to be open and available to folks in the community. We are creating more and more groups as we speak to be able to respond to what we know will be an increased need for people to reach out and get connected, and to be able to look to working through their traumas and their anxiety and so forth. And so we, we as an agency are here for the community, and we are ready to start working with people when they are ready to start dealing with some of those things that they've had to deal with over the last several months.
I was just wondering if either of you saw any positives coming out of all of this. I mean, we've all had to figure out workarounds.
Andrew, there have been so many positives. Kaya touched on some of them, Lorna touched on some of them, but the opening for staff to do things differently and yet meet people's needs. It took them a few moments, a few days to kind of take their breath and then really get a push to engage in doing things differently and saying, well, people really need this. And then we'd say, well, how are you going to get it to them? And then, well, we could do it this way. How about we try? Yes, let's do that. And we've been, because we were set up, we've been able to make use of changes from CMS, Center for Medicaid and Medicare Services, that released the restrictions on telehealth and doing telephone conversations and things like that, that we used to say, well, you have to come into the office. Now it's like, where can we help meet you and keep you safe and provide the necessary supports? And that's going to be very much true going forward. One of the things that is similar, as Lorna's touching on with trauma, that is similar to death experiences, because we've had a number of people die. And if you're in a community, then you've been affected by death from COVID as well as other sources. There are people who are still sick and still recovering. So they had the specter of death and they didn't die, but you got afraid about that happening and it didn't happen, but now you still have the consequences of surviving, or maybe your health not being quite the same or being at greater risk. So those kind of unknowns all contribute to that sense of free-floating anxiety and uncertainty. And everybody handles the loss or the uncertainty differently. There's no one right sequence that you should be following your reactions. That is the only way to do it. As many people as we are, there are that many ways of doing it. And so part of what Lorna's talking about, our agency and our clinicians being open and available, is that we're ready to meet people where they are.
Yeah, and just to kind of jump on that whole, what has happened that's been positive, this whole telehealth thing, COVID has forced us 5 years into the future as far as being able to provide telehealth services to people in the community that we would have been struggling through trying to figure out how to make it work. But because we didn't have that time to process and figure it out, we just made it happen. That's been one of the underlying positive pieces of this whole thing, is that being able to just do what we need to do to make people whole and to work with our community in whatever way possible. We just did it. We didn't have to think about it. We just did it. And that's been a blessing, actually.
Well, fascinating. Well, we could probably talk about a lot of this stuff for much longer, but we're just about out of time here. Thank you all very much for being with us today to share some of your insights on this very tricky subject. But anyway, all the best to you all, and thanks again.
And if anybody needs us, it's 802-442-5491. That's
yeah.
And the website is ucsvt.org?
That's correct.
All right.
We're here for you.
Okay, thank you very much, Lorna Return, Alia Reeve, and Kaya Ganguly for being with us today. All the best to you all. Good luck.
Thank you.
Thank you, Andrew. Thank you so much.